what can you tell us about the research behind having your tubes tied?
The CREST study is the largest study to date. That study collected information on patients, the type of tubal ligation, as well as various other factors from the 1970s until the 1980s. And the main purpose of the CREST study was to look at the safety of each method of tubal ligation from a surgical standpoint, what were the surgical risks, and then the failure rates of each method. And that study was first published in the 1990s, and it provided us with the first concrete information we had as to what were the risks of each method of tubal ligation. It did look at menstrual irregularities or effects on the menstrual cycle, but it didn't really do that in depth. Essentially, the study asked patients 6 simple questions about their menstrual pattern after tubal ligation. And the conclusion of that small portion of the study was that there was no effect of tubal ligation on menstrual cycles. But that study was done on women from the 1970s to 1980s. So
what I'm hearing is that is the main study, but it never studied the effects beyond a woman's cycle and the rest of her body.
Correct. Essentially, they asked 6 questions about what changes that women notice in their periods after tubal ligation. And they asked it to one group of women who had tubal ligation, and then they asked it to another group of women who did not have tubal ligation, but their partners had vasectomy. And when they compared the two, they essentially came to the conclusion that there was no changes on the menstrual pattern. But they really didn't ask or investigate other questions about the other symptoms that women could be having after tubal ligation.